And now the government is concerned following a decline in the number of Kenyans seeking treatment for malaria since the onset of the pandemic. Health Chief Administrative Secretary Dr. Rashid Aman is attributing the decline to fear of being tested for COVID-19 owing to the similarity in symptoms. This comes as the number of coronavirus cases rose to 32,803 after 246 more cases were confirmed. The number of fatalities also rose to 559 after 5 more patients succumbed to the virus.
A worrying trend has been developing in the country since the first coronavirus case was reported back in March. A number of Kenyans opting to stay clear of hospitals for fear of being exposed to the virus with the notion that the facilities were not safe. It is a trend that has led to a decline in number of patients seeking treatment for various ailments, with many opting for self-medication. For instance, the Minister of Health is reporting that before the pandemic, over 300,000 patients were being treated for malaria in the country per week, a number that has now dropped to about 100,000 patients per week.
Majority of those who develop malaria symptoms prefer to go and self-medicate themselves during this pandemic time by purchasing drugs from chemists. Remember that the symptoms are similar, so people might fear that if they go to a facility, they will be tested for COVID-19, and you know all the other issues around the stigmatization of this disease.
The ministry is saying that if the situation is not reversed, the patients may end up developing severe forms of the disease and complications.
Majority of those with malaria who fail to seek proper medication in good time when the disease is still mild end up doing so when they have severe malaria. This could complicate their health status, as it is likely that some may lose their lives.
The concern comes on a day when the number of positive cases rose to 32,803 after 246 new cases were confirmed from 4,149 samples tested.
These commodities for testing are rather scarce and they are in high demand globally. So that supply chain is not very stable. We have done all we can, even working with manufacturers in those countries where they manufacture these products, to try to get special quotas from them to ensure a steady supply chain.
Nairobi had 75 cases, followed by Kiambu with 28, Kisumu 18, Machakos 16, Garissa 13, Lamu 10, while Turkana and Migori each had 9 cases. 160 patients also recovered, out of which 120 were from the home care program and 34 from various health facilities. The total number of recoveries now stands at 19,055, with that of fatalities rising to 559 after 5 more patients succumbed to the virus. Meanwhile, the Ministry of Health received donations of malaria drugs from the Fosun farmer worth 73 million shillings. Nancy Okware, Channel 1 News.